You have that? I'll keep going. So Gary, I've read some of these articles in the newspaper recently about quality.
Yes.
What is Kaweah Delta doing to improve their quality?
Yeah, so excellent question, and I touched on it on my opening remarks. Definitely the areas that we have been struggling are with respect to patient experience. So virtually every patient that is admitted into the acute care hospital and discharged receives a survey after that experience, and it asks them lots of questions about how well did your doctor communicate with you, how well did your nurse communicate with you, how well did we control your pain, did we explain the discharge instructions to you well, how clean was your room, how was your food, was it quiet, 30-something questions. And if the patient answers anything other than always, meaning we always did it well, so they have the choice of putting always, usually, sometimes, or never. And if they answer anything other than always, then it's a 0. And that's what goes into that C grade that we receive from Leapfrog. So there's a big component of hospital safety is based on the patient's experience, which makes sense, because if the patient doesn't feel that we communicated well with them as a nurse or as a doctor or didn't control their pain, then that certainly is a reflection of quality. And so with Ed's leadership and Diane, we are launching a new initiative called Operation Always, working with our doctors, working with our nurses, all of our staff, housekeeping, food services, to really focus on those aspects of care. And it will take us a while. It's not something you turn over overnight, but we're very committed to improving that. The other area that leads to the C grade is that prevention of infections. And these are hospital-acquired infections. So obviously, patients come to us with infections all the time. They already have a urinary tract infection or cellulitis or MRSA or C. diff or something like that. They come here, we treat that does not count against us. But if a patient comes in and they contract MRSA, or we place a central line in them to provide medications or fluids, and that central line becomes infected and causes a central line blood-associated infection, then that counts against us. And so we're aiming for perfect care, zero harm, perfect care, but we take care of a very sick population, as you might expect. And very sick populations are more vulnerable to infections. So you often see that large complex hospitals like Kaweah Delta are struggling in the same area. So one of the things I had shared with the Times-Delta reporter that unfortunately wasn't part of the recent article is that Cedars-Sinai Hospital has a C grade. UCLA has a C grade. Most of the large hospitals in Sacramento, Sutter, and others have C grades. And we're struggling with that infection prevention. So we actually have committees that are dedicated to focusing on CLABSI, CODI, C. diff. They have nurses and physicians on them. And literally every time that infection occurs, we do kind of a root cause analysis to really understand what happened. Did we not scrub the hub well when inserting that central line? Or did we not clean the dressing well? Do we leave it in too long? So we're going through that thorough evaluation right now and looking at what process changes we need to make. We also are recruiting right now for a chief quality officer. So that's an emerging role in large hospitals, that you actually have a dedicated executive as part of the organization that is focused solely on improving quality in the organization. We've never had a chief quality officer, so we've been actually recruiting, unfortunately, almost for a year. But we want the right individual with the right experience and education and skill set And we actually have a candidate coming in January that, by all accounts, appears to be outstanding, coming from New York, PhD trained, and we think could potentially be very impactful on our quality.